happy to be joined by one of our Unite for Her providers, but one of the best in the industry, to talk about a topic that isn't the easiest, but we know how meaningful it is. So we will dive in just a moment. But for those that haven't seen our promos, or hopefully you have, today's Ask the Experts is all about relationships and sexual health. First, I want to give a big thanks to our sponsors. Every month, they help us bring these important discussions to our Unite for Her community. So today's Ask the Experts is presented by West, Merck, and Daiichi Sankyo, with additional support from GSK and Lilly. Because we have a lot of important things that we want to cover, I want to introduce my expert for today. So it really is my pleasure to be joined by Dr. Sabitha Pillai-Friedman. She is an adjunct associate professor at the Center for Human Sexuality Studies at Widener University. She's also a relationship and sex therapist at Rittenhouse Relationship and Sexual Health, and has served as a sexual health consultant and provider for Unite for Her since 2015. She is an AASECT certified sex therapist and approved supervisor, and she works with both individuals and couples in her private practice in Philadelphia. She has more than 25 years of experience in providing individual, couple, and sexual therapy, and presents both nationally and internationally on wide-ranging topics related to relationships and sexuality. So it truly is my pleasure to join me today, Dr. Pillai-Friedman. Thank you so much for being here, Sabitha.
Thank you, Erin. What a great introduction. Thank you very much. Glad to be here.
Of course. Yeah, this is always, we know so often this is a difficult conversation. This can be awkward for a lot of our community, but it doesn't mean it's any less important than, any other conversations we'd have around health and a cancer diagnosis. So we're glad that you're here to provide some guidance.
Absolutely. There is a lot of shame and silence that surrounds this topic. That is why I feel like it is very important to have these conversations, because not many people are talking about it and giving answers to people who are asking questions about it.
Mm-hmm. Mm-hmm. Good. Well, hopefully, and I think we'll be able to provide some tips and some phrases and some suggestions to those moving forward. So hopefully they can start to feel prepared in having these conversations on their own.
Yes, I agree.
Okay, so let's jump right in. Like I said, we'll be weaving in some of the questions from our community. But I want to start with, just sort of the baseline for our community, understanding that with a cancer diagnosis and going through treatment and surgeries, the physical changes that happen, obviously there's an effect on sexual health as well. And so one of the questions we offer here is just the general question, like, will I be able to have a normal sexual life, relationship life back? What do you typically say to that?
That is a great question, and it comes up all the time. First of all, I would like to know what people think is normal. Because when you say normal, people have in mind a certain kind of sexual activity. They are thinking about penetrative sex. They're thinking about what they have come to consider as the only way to have sex. So what I like to tell people is, first of all, you will have to create your own script about what feels good to you. So I really hesitate to use the word normal when we talk about sex, because sex is such a broad, wonderful buffet of things. So yes, you can be sexual. It is just that you have to change your mind about what sex is. There are so many options that are available to us. Our sexual body is incredibly diverse. We can do so many wonderful things with it. So I would like people to stop thinking about what is normal and think about, what am I able to do? How can I maximize pleasure with what my body can do right now?
I love that. I love that focus on perspective because I think you're right. You know, we have a certain expectation for what we think it should look like or what it has looked like in the past. And so if we can focus on shifting that perspective, perhaps, you know, the difference can be a little bit easier to understand and accept.
Absolutely. I find that when I really take people in this direction, when they look at sex, that sex is anything you want it to be, and
Mm-hmm.
enjoy what your body can do right now, they feel really liberated because this normal sex is almost like a shackle. We are kind of tied
Yeah.
with that. And this is the only way we can have sex. So after having baby or as we get older, we can't have sex because this normal sex is only for the healthy and the acrobatic and people with perfect bodies. That is not
Yeah.
true.
No. No, right. And I will say so in a lot of the questions that we received, there was a word that came up quite a bit, which is self-conscious, right?
Yeah.
I'm self-conscious about the function when I'm with my partner. I'm self-conscious about how my body looks. I've had scars, my weight has changed. So, how can someone that's feeling this way um, become more at peace, so to speak, with the change, with sort of their post treatment body and how it works, and then even learn to sort of embrace where they are currently?
Mm-hmm. First of all, I want to acknowledge there are several losses that come with cancer diagnosis and treatment because our bodies change in many, many different ways. There are, because people go through surgery, they go through treatment, cancer treatment. And as a cancer survivor myself, I can relate to that.
Mm-hmm.
With surgery comes loss of, certain body parts and sensation, and you have scars where you don't expect to see scars, and you lose your hair. So there are many reasons why people feel the way they feel. First of all, I want to honor them, and I also want to honor their loss. It is a loss, but there is a way forward. And the way forward is to really, this is our body. And the body has been through many of these experiences, the medical treatment and the surgery and the pain, and is still there, standing there with us.
Mm-hmm.
So I encourage my clients to look at their body as a good friend and to show self-compassion, to show
Mm-hmm.
compassion to your body. If you can embrace the body with self-compassion, again, this is not something that happens overnight. This
I,
is a journey.
yeah, yeah. I was going to say I can't imagine that would be something that a person would easily or very readily be able to get to, given the scope at which they've been through.
Absolutely. So I encourage people to be patient with themselves. And, first of all, be optimistic that your body will, you know, be sexual and you will be able to enjoy sexual feelings. But it is a journey to get to the point of complete acceptance of where your body is and what it can do sexually. So,
Yeah.
Aaron, before we started this conversation, I gave you some resources on self-compassion
Mm-hmm.
by Dr. Kristen Neff, who has a beautiful web page on self-compassion. There is a section on body and self-compassion. And so she has a wonderful
I love that.
exercise um, for people to do on a regular basis to embrace the way their body looks. Practical tips: do whatever makes you feel good. I remember when I was going through chemotherapy, somebody told me, go out and get a number of beautiful lipstick colors and
Yeah.
put it on every day. And I started doing that. I still have like about 10 containers of lipstick that I got during that
I love
time.
it.
So,
Yeah.
do whatever makes you feel beautiful. If it means, buying a certain kind of outfit, getting your hair done, if wearing a wig that looks good. So I would say for practical reasons, do what feels good to you, what makes you feel good. And when you're with your partner, if a lingerie covers your scars and makes you feel better, please go ahead and do so. And you can
Hmm.
also talk to your partner about how important the lingerie is for you and that you really do not want to remove it. Because
Yeah.
then, this gives you time to get used to your body.
Yeah. I love that. And sort of setting that expectation ahead of time, um, you know, I would imagine can help to relieve some of the nerves that might go into a situation where, a person might feel uncomfortable. I want to keep this on, what's going to happen. So just sort of being upfront about it and sort of lay that groundwork so all parties are on the same playing field, so to
Absolutely.
speak, and you can feel more comfortable about, like what you said, makes you feel good.
Absolutely. Absolutely. That results in self-confidence, which is
Mm-hmm.
also very important for
Mm-hmm.
being comfortable during sex.
Yeah, I love that. And I know we'll get into sort of communication, and
Yes.
talking with partners in just a moment, but I want to touch on a little bit. So again, sort of one of those underlying themes that we heard a lot from our community, and to no surprise, even just from our
Yes.
segments we've done with you in the past, you know, um, desire and libido
Yes.
around
Yes.
intimacy
Yes.
is certainly something that is altered, diminished quite a bit in our community, and we hear that often. So, how can one expect to get their libido back, when they have this side effect from medications they're taking as a result of perhaps certain procedures? Um, any suggestions on that?
That is a fantastic question. Yes, many of the medications and treatments do interfere with desire because testosterone is responsible for desire, estrogen is responsible for arousal. Both
Mm-hmm.
of these um, hormones are compromised during treatment. So there is definitely a reduction in desire. Having
Mm-hmm.
said that, yes, our body is what, kind of is responsible for desire, but I find that brain is the biggest sex organ because
Mm-hmm.
when you have sexual thoughts, it can actually fight through all the side effects and arouse you. You can actually create desire in your body by coming up with sexual thoughts. So now I want to take a pause for a minute to talk
Mm-hmm.
about how how do you kind of work on your desire and arousal on your own first? It's very important to work on it on your own before you share it with your partner. So, if you're self-conscious about your body and whether you're feeling desire, whether you're feeling aroused, it's very important to self-pleasure, to sort of see what turns my brain on.
Mm-hmm.
And I have in my resource list several erotica material. So
Mm-hmm.
it is really important because there are sexologists and researchers who have used the terms sexual fantasies and desire
Mm-hmm.
in the same breath. They literally,
Mm-hmm.
use them synonymously. So sexual fantasies are really the juice that gets your sexual desire going.
Okay.
So if you want to read 50 Shades of Grey, go right ahead. If you want to, is there any erotic material that
Yeah.
creates that little tweak in your brain? Go for it. Go for it.
Yeah.
And also regarding arousal, you need to really first self-pleasure and see how your body enjoys sexual touch and sexual pleasure before you go into sexual activity with your partner. Because whenever you are with your partner, at least a small part of your brain starts to do what is called cognitive distractions or spectatoring. So it
Mm-hmm.
starts to go, is he looking at my scar? Is she looking at my scar? Is my body,
Oh,
are my, is my bald head causing concern to my partner? Is
yeah.
so all these negative messages can sometimes start playing in our heads. So it is
Mm-hmm.
very important to first get used to what your body can do on your own.
Mm-hmm.
Because when you're self-pleasuring on your own, then we don't have those distracting thoughts. But when we're
Mm-hmm.
with a partner, we have those distracting thoughts. So if you can be comfortable first with yourself, then you can share yourself with your partner.
And and I love that you said that, because I'm also seeing that relationship with how we started this conversation, which was around self-compassion and
Yes,
shifting perspective and working on sort of where a person is currently. And then we start to see that trickle down effect where we're seeing comfort with our bodies and intimacy. So you can really start to see how everything is related.
absolutely. It's all related. So
Yeah.
your comfort with yourself and your kindness to yourself and your ability to enjoy your own self first is going to determine how comfortable you are in partner sex.
Mm-hmm. Mm-hmm. That's that's really good to know, especially sort of highlighting the effect the brain has on intimacy and desire. And to that point, so we did have a question from our community. This person wrote in, I had all my internal female organs removed. Is it okay if I don't want to have sex? I feel all of my drive has gone to zero. Due to my cancer diagnosis, hormone replacement therapy is not an option. Do I have a problem? Do I need to be treated?
You do not have a problem. If you do not want to have sex, it is okay. You're the only person who can determine if you want to have sex or not. If
Mm-hmm.
you're in a partnered relationship and if your partner is unhappy, then you may want to seek some help and if you want to continue to stay in the relationship, you want to seek help because your partner is unhappy. But
Mm-hmm.
if you're single or if you're in a relationship where your partner is like, take your time, it's okay, then take your time. It is not, do not force yourself to engage in sexual activity that you do not feel comfortable with,
Mm-hmm.
because as I told you before, it's a journey. It takes
Yeah.
time for your body to, change and to get used to the thought of having sexual activity.
Yeah. And I would imagine what you just said, this is a journey. Just because a person may not want to do that now doesn't mean that in the future, down the line, as time moves forward, that it will be that way forever and ever. So, like you said, it's a journey. How a person feels today or in a month may not be the same in 6 months, in a year, sort of as the body continues to heal and move forward.
Absolutely. And you never know what you come across in the movies you watch, in the books you read, that kind of turns that little button in your head
Mm-hmm.
that's like, oh, I feel something. So
Mm-hmm.
then that's when you will know that, okay, your body is actually interested in something more
Yeah.
than just reading. Maybe you want to, take it to the next level.
Yep. Yep. I love that. Okay. We had a couple questions come in just about estrogen levels, and certain side effects with libido and desire, which I thought was really great questions. So one person wrote in, Is there an increase in estrogen levels if a person has an orgasm, even if they have a hormone receptor positive breast cancer? And should this be a concern for those that are HR positive?
It's a great question. I know about the study. It's a 2001 study. There is a very small amount of estrogen that can be produced when we have orgasm. But if you
Mm-hmm,
are doing all the other things, if you're taking medications and if you're to suppress estrogen production, this
mm-hmm,
small amount of estrogen that's produced during orgasm is
mm-hmm.
not a reason for concern.
Okay.
In fact, the orgasm has so many positive effects on our body, because it gives us this warm, happy feeling, bonding with your partner. And they also say it even, helps us with, deal with infections, makes us stronger, gives us more immunity, and
Yeah.
improves the glow in our face. So, I think orgasm has many positive, reasons to have an orgasm. So I would suggest this small amount of estrogen increase is really not a reason for concern.
Okay, wonderful. And I'm glad. I didn't realize that this was based on a study. So, our community, they're always reading and researching. So it's really good to have that clarification. So thank you for that.
Absolutely.
Something else that came in also regarding sort of shift of hormones, a question from one of our members or from the community, was around, certain side effects that I think a person may expect to experience with being in menopause, typically vaginal dryness. So in menopause, if someone is not experiencing that, although their blood levels indicate they're in menopause, their ovaries have been removed, is that a sign that they may be still have a significant level of estrogen that they're producing, or is that a cause for concern?
It is definitely not a cause for concern, and you should consider yourself lucky that you're able to feel,
Yeah.
you're able to lubricate, in spite of the estrogen suppressive
Mm-hmm.
therapies that have been offered.
Mm-hmm.
You know, when I work with a wide range of people, and I sometimes see 27-year-olds who are extremely who lubricate very well. I also see 27-year-olds who are dry and who need a huge amount of lubrication, external lubrication. So
Mm-hmm.
the same applies to people who are going through cancer treatment. Some people do not seem to be impacted by the estrogen suppression therapies and seem to be able to lubricate. And you may be one of those people. So I would count your blessing and not worry about it. If your
Okay.
blood test levels show that your estrogen has been suppressed considerably.
Okay. Wonderful. Thank you for that. Okay, so moving along, diving a little bit into, like I mentioned earlier, sort of the communication aspect with relationships, with intimacy. This is a tough one. We hear this quite a bit in terms of how someone starts this conversation, when to start it. And so our first question again comes from one of our community members. I love this. We sort of touched on this when we did our dating and cancer last year, but should I be upfront with someone about my medical history? When is the right time to explain breast reconstruction, which we hear a lot for those that are dating,
Yeah.
if looking to enter a new relationship? This is a tough conversation to be had. What do you say to that?
That is a good question, but different people have different perspectives.
Mm-hmm.
So this is my perspective based on a lot of thinking and my experience working with single people. Um, I really think that it is best to talk about it after a couple of dates. I will tell you why. You do not want to be, you do not want cancer to be who you are. You're not cancer,
Yeah. Yeah.
right? So my belief is to put cancer in its place. It's a small part of your life. Okay. It may have been big at some point, but now, it is dwindled and there are other things you're doing. You may be an artist, you may be a teacher, you may be a chef like Aaron, you may be doing all these cool things. So I would like whoever meets you to know the whole person. So let them know you as a person who is interested in hiking and sports and love dogs, all of these things before you tell them about your cancer diagnosis. And
Hmm.
after they hear about your cancer diagnosis and your treatment or your whatever treatments you've gone through, if they decide that you're not the person for them, then it is fine. It is, you've averted a bullet. It's okay.
Hmm.
They would not have been the person to pursue anyway.
Hmm.
But let them see you as a whole person before they make
Yeah.
the decision.
Yeah. I love that reminder of you are so much more than just your diagnosis, and really setting that standard that, this is who I am going to be first and foremost. Are all these other things, we'll get to that when the person is ready. I love that reminder.
Absolutely.
Okay, that's great. I love that tip. Um, So moving on in the same communication, sort of different scenario for those that are in an established relationship. We had one question that came in.
Yeah.
This person, I had breast cancer, chemo, radiation. They've been on an anastrozole for 8 years, no libido. It is a source of stress between this person and her husband. Any suggestions for how to have this conversation? And I would probably say, constructive tips on how to work through, because, this can be a really emotionally charged conversation. So, how can someone have some constructive conversation with their partner?
I love the word constructive because that's what I think works in the situation. I work with
Yeah.
a lot of couples. So I work with couples who are dealing with other kinds of stressors. I work with couples who are dealing with a diagnosis. I work with breast cancer survivors, prostate cancer survivors. I find that communication becomes very strained because,
Mm-hmm.
I'm just going to take the example of a breast cancer survivor or someone
Mm-hmm.
who's going to treatment. They start feeling uncomfortable with their body and with sexual activity. So they do not want to bring up the topic with their partner. And the
Mm-hmm.
partner similarly feels like they can't bring that up because, she's going through a lot and I don't want to, bring up another stressor into her life. So I'm
Right.
not going to talk about that. So gradually what happens is they stop doing all the loving things they used to do before, like cuddling, touching, spooning in bed, holding hands, because they are both, if you can imagine, they have talk bubbles. They both have
Mm-hmm.
talk bubbles. If I hold his hand, he's going to want more sex. He's going to want sex. Or
Mm.
if I reach out to her in bed and want to spoon, she's going to think that I want to be sexual. So
Right.
I'm going to not touch. So gradually they stop touching. That becomes the big issue because they've
Yeah.
stopped doing all the intimacy producing activities. So it's very important to have conversations like, I really don't want to, engage in such and such,
Mm-hmm.
whatever they want to do. But I
Mm-hmm.
would love to cuddle. Can we just cuddle and watch a movie together?
I
Or,
love that.
yes, or can we take a shower together? Because I would love to take a shower with you, but I really do not want to do anything else. Is that okay? Just
Yeah.
giving your partners permission to come and touch and hold and do something that they used to do before, but with boundaries. Like, I'm not sure I want to have penetrative sex because I don't feel comfortable yet. My body is not
Mm-hmm.
ready. But can we do
Mm-hmm.
something else? So that sort of communication really brings couples together. So, because the reason why there's stress is because one person is thinking, this is never going to change. They start to catastrophize the situation and think, this
Yeah.
is never going to change. My partner is never going to want to be touched. And now we are both in different worlds. So, in order to, really address the catastrophic thinking, I usually
Yeah.
suggest that they think about ways to connect in ways that are comfortable for both of them. So they
Hmm.
are at least creating some intimate moments with each other, which
Yeah.
makes them feel hopeful. And
Yeah.
that is the key.
I love that. I love that last part, makes them feel hopeful, right? It doesn't have to always result in one thing, but just again, sort of that reminder that you have all of these other ways to have intimacy and share special moments with your partner. And sort of letting go again of that expectation of what we think the final product should be, but let's sort of focus on these other things: spooning, hand holding, just like general physical touch. I love that.
And if they want to go any further, if the partner wants to masturbate, they can lie in bed with a person and hold a person. This would be very satisfying for a lot of people. So that is
Hmm.
something I suggest as well when they want a little bit more. Those are also ways to offer a connection in a shared space.
I love this. So even in the context of, perhaps sort of managing this conversation with someone that may not have a libido, but also around, the things that someone found enjoyable before diagnosis, sort of before
Yes.
that treatment.
Yeah.
But
Yes.
how can someone, especially if they're, it's a difficult conversation to have, expressing that, okay, what I used to enjoy, I no longer find pleasure, it's no
Yeah.
longer something that I enjoy. How can that person sort of navigate those issues?
That's a very good question. I get this question all the time
Mm-hmm.
about breast sensation, because breast
Mm.
is a very important secondary sexual organ, and it is,
Mm-hmm.
it's usually, it arouses people. So when you do not have sensation and you also experienced scars, sensitivities, then, it is important to mention that to your partner.
Yeah.
I'm not sure, I'm not ready for it. It's better to just say, I'm not ready for it, because you actually are not ready for it, but eventually you may be. So
Mm-hmm.
instead of saying, I don't want to be touched, which is a definitive way of saying things, you could,
Mm-hmm.
remember this is a journey. So you're still on the journey. So if you could keep that in your mind, you would
Yeah.
communicate differently. Hey, right now, I'm not up for it because I feel like my body is still not ready. But how
Mm-hmm.
about we try this? Offer an option. And also, when you approach something that you're not into right now, make sure you let them know that in the future it is a possibility that I'll feel better.
Mm-hmm.
Because a lot of people, after they have been through double mastectomy reconstruction, after some time, they start feeling comfortable with your breast. And
Yeah.
they may not have the same sensation they had before, but they may be able to include their breast in sexual activity in ways that
Mm-hmm.
are comfortable to them.
Yeah.
So, just again, keeping the hope in conversation, sexual communication would be very
Yeah.
helpful.
Yeah. And even again, going back to that whole perspective thing, even as a person shares that with their partner, just as a reminder to themselves, like, this isn't necessarily the be all end all. There is still hope, and there is things continue to change and shift. And like you said, may not be the same sensation, but maybe a different one that can, enter in as part of in the intimate space. So even just sharing that as a reminder to oneself too.
Absolutely. Yes, you're right about
Yeah,
that.
I love that. I love that. Okay, another question that came in, which is a tough one. You know, it was, my heart feels for this individual, but I know that they are not alone. This person sent in a question: how do I deal with a partner that isn't attracted to me anymore because of mastectomy, menopausal symptoms? Does this happen in a lot of relationships after breast cancer? Um, what do you say about that, Sabitha?
I know it does break my heart to hear that as well. Um, it does happen sometimes. I
Mm-hmm.
have worked with individuals whose partners have lost interest, but sometimes, so there is a possibility this is happening, but sometimes it is communication again.
Mm-hmm.
Because if the partner feels that any sexual activity is an impossibility
Mm-hmm.
because the person who has had the cancer and treatment has withdrawn completely and
Mm-hmm.
is not even able to reach out for a touch, for a hug, for some kind of creative sexual connection, then the partner may feel like, okay, there's nothing left here because this
Okay.
person is not willing to reach out to me. But it could also be the partner who is withdrawn completely because they are too afraid, that they don't want to hurt the person's body, they don't want to
Yeah,
upset them.
I was going to ask, is there an element almost of fear here for that
Yes,
partner, of the
yes,
unknown, of
yes.
not, not understanding what the person is going through?
Absolutely, absolutely. So that fear can be resolved with communication. So when
Mm-hmm.
couples come to see me and they mention that they have this fear, I say to them, tell me what your real fears are. And sometimes they say, I'm afraid to hurt her body. I'm afraid that she's going to think that I want sexual touch when she's going through all this. And she may think that I'm not being sensitive to her.
Mm-hmm.
Uh, so they may also sometimes say that that there are certain changes to the body that makes them worried that she may not feel any positive feelings in her body.
Mm-hmm.
So, so once I establish what the fears are, then I can help them communicate better because our
Yeah.
fears are always worse than the reality.
Yeah.
So,
Yeah.
so
In so many instances, including this. Yeah, you're right.
if they could just, be more comfortable with each other, and if they can, introduce touch gradually with good communication,
Mm-hmm.
then maybe there would not be that sort of hopelessness that leads to leaving the relationship. But
Yeah.
there are also people who are not in relationships with the tenacity that it takes to be in a married or in a partnered relationship. Some
Yeah.
people cannot deal with hardships and may leave because they're not mature enough to deal with it.
Yeah.
So
Yeah.
unfortunately, this is a situation where you may just have to think that maybe this is not the person for you.
Yeah.
And it has happened sometimes, like in all relationships, sometimes, people, break up after a baby, after they get older, after a
Mm-hmm.
move, after a stressful job experience. So this could be a stressor in a marriage or a
Okay.
relationship.
Okay. But definitely worth, especially in this sort of instance, I would say, working with a professional to really assist both
Yes.
parties, to really support that communication and hopefully get to the root cause and sort of work through that.
I would say it is worth it to go see a therapist
Hmm.
for at least a few meetings to know what can be done. Because
Yeah.
the two of you are not talking and there's a distance between you, then a neutral party may be able to establish a connection.
Yeah, that's a really good point. Yeah. Sometimes you just need that neutral party.
Yes.
Yeah.
Yes.
Okay. We've got a couple moments left. I want to just round out by quickly touching on to close us out. We had some questions just about products or supplements. So real quickly, are you aware of any supplements that may be good for vaginal health post-menopause? And also we had a question that came in about painful intercourse. So any sort of suggestions on, I know sometimes a pelvic floor specialist could be helpful, but any sort of suggestions, safe suggestions for how someone could work through that as well?
So I'm gonna take the sexual pain question first because it is really, really important. Yes, a
Okay.
lot of people who who go through cancer treatment experience a degree of pain during penetrative sex.
Mm-hmm.
It is because when estrogen is depleted from your body, your arousal it interferes with arousal. So penetrative sex can be painful. So there are a couple of
Mm-hmm.
options. It is a very good idea to go see a pelvic floor therapist because
Mm-hmm.
when your body lacks estrogen, then your pelvic floor can also be affected by it.
Mm-hmm.
So penetrative sex is painful because of two reasons. Your pelvic floor could have changed because of the lack of estrogen,
Mm-hmm.
and your vaginal walls are dry.
Mm-hmm.
So it's a good idea to go see a pelvic floor therapist. And I've put the website for finding pelvic floor therapists in
Perfect.
my resource list. So go
Perfect.
find somebody, and most of the times it's paid for by insurance. That's another
Mm-hmm.
good thing. And another option would be to use dilators.
Mm-hmm.
So there are dilators that, these are called graded dilators, and most of the resources list I've given you, the sex shops will have it. So these are
Okay.
like graded dilators that they can use to work on the vaginal walls, to
Okay.
loosen the vaginal walls themselves
Got it.
before penetrative sex. That can be very useful. Most importantly, using lubricants
Yeah.
that are, kind of friendly to the vagina, which are, do not
Yeah.
have parabens, do not have arousal oils and things, water-based lube. And I know
Mm-hmm.
that for her offers a sample of Good Clean Love. Is a great
Mm-hmm.
brand because it has organic lube. So finding a lube that can really help with penetration can be very useful. And on a regular basis, using moisturizer to moisturize the vaginal walls so it can stay supple and
Mm-hmm.
can really help with easy penetrative sex.
Mm-hmm. That's really good to know. And we will include your resource list as well as, links to Good Clean Love and other products um, in with the video recording and in our resources on our website. Yep.
Sure. Thank you. And this
Mm-hmm.
one, you asked one other question. Did I miss it?
About supplements. Yeah, we got
Supplements.
a question for vaginal health supplements. If you're aware of any that are safe or what someone should consider.
Well, in my opinion, the supplements are whatever you offer, Aaron, which is good food,
Mm-hmm.
really good food, because fish oils, you offer a lot of wonderful, healthy food in your demonstrations,
Mm-hmm.
eating healthy, exercising, because exercise brings blood flow to your pelvic area. So
Mm-hmm.
that can be very helpful. And, I have to say, masturbation, self-pleasure, because when you self-pleasure, it brings blood flow to your clitoris and to your genital area, which can be really amazing. So when you talk about supplements, I want you to think about food, exercise, self-pleasure. These are the
Mm-hmm.
trifecta of supplements that I would say are good for your vaginal health.
Good. Okay. And all things that we have accessible to us: food,
Yes.
exercise, movement, all of the above. Yeah. So we love that. Okay. Well, this is about the end of our time. We've got through some really, really wonderful questions for today. Any final notes for our community, Sabitha, that you want to impart before we disconnect today?
Well, I want everybody to think of sex as something playful and fun, and you do not have to do things you do not want to do. It is a choice. It's like a buffet. So go enjoy parts of it that you like, and you can avoid parts that you do not like. You can eventually get to if you want to. So most people, I find that after diagnosis and treatment of a health condition, think of sex almost like an exam that you're passing or failing, that I'm failing in sex.
Oh,
And
yeah.
it breaks my heart when they tell me that, because it shouldn't
Mhm.
be that way. Because it is, just think of it like a playground, and you can pick whatever you want to do that pleases your body.
Mhm.
So that mindset would really go a long way.
Yeah. I love that. I love that. Well, Sabitha is one of our providers for those that are in our passport program. She also has clients in the Philadelphia area. So, for anyone that's watching, if they're interested in connecting with her or using passport squares, please feel free to reach out. We'll include the link to her website as well. Of course, as you can tell, she is absolutely wonderful in what she does. So we appreciate your time and imparting your knowledge and experience with us today.
Well, thank you very much. This was such a pleasure. Thank you.
Always, you're welcome.